Good evening. So today I will be talking about medical marijuana slash cannabis and the reasons why it should be legalized for medicinal purposes. Marijuana, also referred to as weed, pot, or grass, is classified as a psychoactive drug. Hence, its use for medicinal purposes. The medicinal property of the drug is a result of the tetrahydrocannabinol, also known as THC, and cannabinoid, also known as CBD, among other varying compounds. The drug can either be smoked or ingested. The term medical marijuana slash cannabis refers to using the whole unprocessed marijuana plant or its basic extracts to treat symptoms of illness and other conditions. THC can increase appetite and reduce nausea. THC may also decrease pain, inflammation, swelling, redness, and muscle control problems. Unlike THC, CBD is a cannabinoid that doesn't make people high. These drugs aren't popular for recreational use because they aren't intoxicating. It may be useful in reducing pain and inflammation, controlling epileptic seizures, and possibly even treating mental illness and addictions. The FDA approved a CBD-based liquid medication called Epidiolex for the treatment of two forms of severe childhood epilepsy, Dravet syndrome and Lennox-Gastaut syndrome. In past findings, a boy aged 6 years old suffered from what was known as an erratic form of epilepsy. They lived in California, but all along the doctor's medication ceased to help the boy. Therefore, they resulted in seeking a different form of treatment using marijuana as an alternative. The condition epilepsy is categorized by frequent and severe seizures. Days into his treatment, they saw him not only growing appetite for food, but also regaining his outgoing personality. The plant singly can combat suffering, offering a substitute source of treatment. Today, I will be discussing the reasons why medical marijuana should be legalized for medicinal purposes only. A patient needs to be aware of all sorts of treatments available for the particular condition. Together with the side effects, medical cannabis usage is legal in certain states, and research is in progress to find viable treatment possibilities. Having laws that prohibit the growth of the plant impacts the field of research for drugs negatively. Medical cannabis reduces anxiety for HIV/AIDS patients. The good mood attributes to medical cannabis, with an increase in feelings of joy and confidence. Also, by law, it gets in the way of a person's well-being and safety. Patients can opt to access medical marijuana illegally, which puts their lives at a risk if they get caught. Medical cannabis is efficient as an alternative treatment method. Unlike most available methods, medical marijuana cures a couple of different diseases. According to Baldini and Von Miller, symptoms of conditions such as Alzheimer's disease and hepatitis C virus remedy attributes to the medical use of cannabis. The usage of the drug dates back to 2900 BC in East Asia. For instance, recent animal studies have shown that marijuana extracts may help kill certain cancer cells and reduce the size of others. Evidence from one cell culture study with rodents suggests that purified extracts from the whole plant marijuana can slow the growth of cancer cells from one of the most serious types of brain tumors. Research in mice showed the treatment with purified extracts of the THC and CBD, when used with radiation, increased the cancer-killing effects of the radiation. In more extensive research, Thomas and Anita suggest that the drug can be made available in liquid form to help minimize the effects that could result from smoking it to the lungs. In HIV-infected people, nausea is a common condition. The condition worsens with time. From a study among patients who had contracted HIV showing symptoms of nausea, the group which used marijuana tended to survive through their severe therapies, unlike the non-users. The federal government should lawfully allow medical marijuana use following the doctor's recommendation, purposely for the group in need of its qualities. Laws have it that possession of the drug is unlawful, except for purposes of research. It is also known as a classified Schedule I drug. Considering the drug as a Schedule II compound means that the drug becomes available as a choice in treatment through a doctor's recommendation. Regulation of the drug comes in aspect that it hinders reaction time together with the clearness in perception. Cases like driving a vehicle under the influence of the drug become illegal. Categorizing the drug as a Schedule II substance will allow the government to control its use. Since acquiring the drug without a doctor's permission gets considered unlawful. The hazards possessed by the use of medical marijuana are far less than any drug. Campaigned by having numerous forms to administer the drug. It is available in liquid form, as I had said earlier. It can perfectly be controlled to do away with its abuse. The resulting advantages would go beyond immeasurable doubt associated with the use. Patients whose conditions could improve from the use of medical marijuana as an alternative mode of treatment should be properly informed. For the well-being of the American people, a cannabis prescription should be made legal. Legalization of medical cannabis will free up law enforcement to focus on other types of serious crimes.